Every year, lung cancer takes more lives than breast, prostate, and colon cancers combined. But when lung cancer is caught through early screening, survival rates can dramatically improve. So the key here, low dose CT scans. They are quick, they're painless, and they can save lives. Yet millions of Americans eligible for screening aren't getting it, either because they don't know about it or don't think they're at risk. LCFA grant recipient Dr. Jonathan Villena-Vargas is here to explain more. He's an assistant professor of the Cardiothoracic Surgery Department of New York-Presbyterian Weill Cornell Medical Center.
Screening is basically what's going to save the most lives compared to everything else. The reason that that's the case is that it catches the cancers very early, and that is the best chance for cure for most patients. So if you take every single patient, if you screen every single patient and caught all the cancers early, over 90% of the patients would be alive today. It used to be that you would just get an x-ray. Somebody that, your doctor would think, oh, my patient's got a cough, or maybe they smoked for a really long time, let's just get an x-ray and make sure. It happened very rarely, and there was a big trial that showed, maybe x-rays are not good enough. So they started doing CAT scans on patients, and then they compared CAT scans versus x-rays and showed that the CAT scans is much better at picking up early stage disease, and the CAT scan is very safe. Sometimes people talk about radiation, but we actually use a low dose radiation scan. It's incredibly safe for the patient. It takes about 2 minutes to do, and it could potentially save a life. I think that the most important thing is that most patients don't even know what lung cancer screening is. Right? Everybody knows about colonoscopies, everybody knows about mammographies, it's on TV, you see it on every sitcom, but very few people know actually about lung cancer screening. So the first thing you got to do is educate people. You have to tell them this is there are very clear guidelines about who gets screened, right? If you're over 50, if you smoke for 20 packs, 20 pack years, or a pack a day for 20 years or more, and if you haven't quit in 15 years, these are very kind of straightforward guidelines, but I don't think people know about lung cancer screening.
Screening saves lives. Take the case of veteran Donnita Butler, who is living with lung cancer. She's an avid hiker, but she says her best step was getting screened for lung cancer. It saved her life.
Hi, my name is Donnita. I'm an Air Force and Navy veteran, retired IT professional, grandmother, mother, and lung cancer survivor. I'm here to tell you about lung cancer screening. I was saved by a low-dose lung cancer screening CT. I had a significant smoking history. I had a lot of exposure to asbestos while I was serving, and I lived in high radon areas quite a bit of my life. I learned about lung cancer screening, and I decided to ask my physician about it. I got my first screening in 2018, and that one came back clear. And then life kind of got in the way. COVID happened, grandbabies happened. I didn't have a great relationship with that doctor, and I ended up switching to another practice. And 5 years later, I asked for another screening. It's supposed to be an annual exam, but I waited 5 years, far too long. But lucky for me, that screening found my lung cancer, and it found it early. There was a nodule in my left upper lobe, and it was 2.8 centimeters, small enough to be classified as stage 1A. That meant that all I needed was surgery. I laugh when I say all I needed, but that's all I needed, was I needed surgery. I didn't need chemo or radiation or any immunology or targeted therapies. I'm back on the trail, living my best life. I'm a hiker before my lung cancer, and I'm a hiker after my lung cancer. And I'm enjoying great adventures with my grandchildren. I have a 5-year-old granddaughter and a 6-year-old grandson, and we go camping and hiking and lots of outdoors adventures all the time. And this granny's gonna turn 70 this summer, and I'm still out here. So, if you have a smoking history or had extensive exposure to asbestos, military burn pits, radon, and you think you might qualify for a lung cancer screening, ask for it. It saved my life. It could save yours. And here I am, back on the trail. Thanks for listening. Bye.